The case presented before us today is the case about confidentiality involving a patient's health information. An OCR investigation confirmed allegations that a dental practice, AU Bright Smiles Dental, flagged some of its medical records with a red sticker with the word AIDS on the outside cover, and that the records were handled so that other patients and staff, without the need to know, could read the sticker. I, Shannon Rouse, have listened to both the defendant and the plaintiff in this case, and I have elected to side with the defendant. I do not feel AU Bright Smiles did anything wrong by placing a red sticker on the patient's chart. I'm sure that we are all aware that HIV/AIDS can be transmitted by several means, including sexual transmission, blood transfusion, breastfeeding, drug use, and occupational exposure. Occupational transmission of HIV to healthcare workers is extremely rare, but it can happen. The Centers for Disease Control and Prevention provides national guidelines for dental offices to help prevent the spread of infections. They include cleaning and sterilizing all non-disposable items such as dental tools between patients, disinfecting surfaces, and requiring staff members to wear protective wear like masks, gloves, and eye protection. The proper use of gloves and goggles, along with safety devices to prevent injuries from sharp medical devices, can help minimize the risk of exposure to HIV in the course of caring for patients with the virus. So in order for providers to be sure that they are using the proper equipment when treating a patient with HIV/AIDS, they have to actually know that they are dealing with a high-risk patient. By marking the patient's chart with a red sticker, alerts the staff and providers that they have a high-risk patient that will have dental work done, thus allowing the dental agency to take the necessary steps to prevent exposure. Now, according to a recent article, some AIDS patients' biggest fears are fears of breaches in confidentiality, which results in individuals actually not accessing treatment in order to prevent the release of sensitive information. This fear definitely affects the care these individuals are receiving. In this case, the representative for AU Bright Smiles did state that there was no other information such as the name of the patient on the outside of the chart, and that the only staff or provider that needs to know information about that, the representative for AU Bright Smiles stated that there were no information such as the name of the patient on the outside of the chart, and that only the staff or provider that needed to know information about that particular patient could access the information. And they can only access the information about that, they can only access information that they needed. Not all patients are protected under HIPAA laws, with no separate guidelines for AIDS patients. There was no wrongful disclosure of the patient's info, no ill intent, and the sticker was only placed on the folder to make sure that both parties, the patient and the health professional, are protected. However, to make the dental patients feel secure, the dental agency can remove the stickers from the outside of the medical records and place them on the inside of the folder. This will help both the healthcare professional stay safe as well as the patient, because the patient would require special procedures and equipment and anything pertaining to that particular disease. They would require special treatment. So this is actually helping the patient as well. But because there was no demographic information or any of the patient's information on the outside of the chart, on the outside of the records, then I do not feel there was a confidentiality violation. Thus, as one of the jurors in this case, I side with the defendant. Thank you.